Midway through my residency, I really realized that there was a problem we currently are just not addressing properly in the system. Among other problems, the problem of diabetic foot care is something that we're really taking a reactive approach to. So as opposed to helping people and empowering them to actually prevent complications before they happen, we tend to step in on the back end once those complications already develop.
Are you talking even worst case scenario, amputation?
Amputation, exactly. So what happens with diabetes is about half of diabetic patients develop a problem called peripheral neuropathy. And as a result of the peripheral neuropathy, they essentially have numb feet. They're unable to properly feel their feet. And so when you can't feel your feet, you don't have a normal pain feedback loop. And without a normal pain feedback loop, you don't know when you're doing damage, you can cause ulcers. Those ulcers can become infected, and ultimately those infected ulcers or extended ulcers can lead to surgical amputation. And so just to give a sense of the size of the problem, because I think it's something that tends to be sort of hidden from the public and that we don't talk about it a lot. Diabetes is sort of gaining momentum, but diabetic peripheral neuropathy, nobody even knows what peripheral neuropathy is if you just talk to somebody on the street. Just to give an idea of the size of the problem, every 30 minutes a leg is lost in the world due to landmines, and every 30 seconds a limb is lost due to diabetes. So the product that we're developing is a pressure-sensitive insole that takes information from the bottom of the foot, and then with that information, it's wirelessly relayed to another receiving device worn on the patient. So the first device that we're developing is a tactile back pad, so the patient actually gets real-time feedback on their back, so they can actually learn to feel their feet through their back to prevent those complications. And then the other device that we're developing is a watch, so instead of transmitting that information to a pad where you feel your feet, you get one-to-one feedback to tell you need to adjust pressure here or you're at risk for those complications that we talked about.
It sounds like it makes perfect sense. It sounds like you could not only save limbs, but in some cases, I'm sure save lives with increasing monitoring and helping with personal health care. I have to ask you, what would you perceive to be the biggest obstacle standing in your way to having this dream of yours become a very real, seeing it actually in action, walking down the street, so to speak?
Yeah, I mean, I think it all comes down to that proactive versus reactive care. It's hard from a patient's perspective or anybody's perspective to commit to something like this before you've seen the harsh realities of what can happen. And so that's a bit of our uphill battle, is actually educating the public and educating people on the risk of these problems. Once a patient develops an ulcer, there's a 1 in 5 chance of amputation. So it's really drilling those facts home and saying, we can give you this device and we can help you to empower yourself and empower you in terms of the control of your disease, and hopefully prevent the loss of a limb. And even one patient would be worth all of the efforts that we're putting in.
Right. Breanne Everett from Orpyx Medical Technologies.